Hi there, everybody. I'm Myra, and sorry for Wave Now's Ask the Doc. And today we are talking about summertime injuries in kids. As a parent who just had a kid who broke their arm and is finally out of a cast, I can say we definitely have to talk about this because spending your summer hurt is no way to go. So I'm happy to be joining Dr. Jennifer Brey, orthopedic surgeon with Norton Children's Orthopedics of Louisville. So we don't want to be in the emergency room or having surgery this summer. What are the most common summertime injuries that you all see?
The most common ones we start seeing this time of year really relate to outdoor activities. The weather's warmer. We have all this data that says when the weather's warm, kids go outside and they get hurt. And it's trampolines, bicycles, hoverboards, scooters, those things where kids are just getting out and getting around. We see a ton of those every summer.
So, the biggest cause of some of these injuries, what are you all seeing?
Trampolines and monkey bars are always kind of the joke in the ER. It's which one did you get hurt on today? So those are probably the biggest two. But any fall from a height can cause an injury.
And can some of these injuries be pretty serious, a broken arm, or are we talking about life-threatening injuries sometimes when these accidents happen?
It can be. The more life-threatening injuries are going to be the more higher energy vehicles like ATVs, unfortunately lawn mowers, car accidents, things like that. Those are the things that can really cause lifelong issues. Most of the time when a kid falls from, kind of a trampoline type height, they might need a cast for a few weeks, but then they're typically not going to have any lifelong problems from that.
And do a lot of these injuries require surgery? I know my son he still has to see an orthopedic physician for a while. Had his arm shaped like an S, and I freaked out from a fall. But do some of these require surgery?
Most most fractures can be treated without surgery and just with a cast alone. There's a second subset that the bones are displaced, meaning they're crooked, but we can just kind of reset those in the ER and then put them in a cast. It's probably only 5 to 10% of fractures will actually need to go to the operating room for some sort of hardware fixation.
And this is an interesting question. Do we see more injuries with boys or girls? Who's more rambunctious?
Boys. It's not a big difference, but if you look at fractures nationwide, about 60% are in boys and the other 40% are girls.
And we were talking about trampolines, and kids love them. They're jumping, they're burning that energy. But why? I had one as a kid, but how can trampolines be so dangerous?
It's there. Unfortunately, there is no safe trampoline. The American Academy of Orthopedic Surgeons, as well as the American Academy of Pediatrics, kind of agree there's not a safe trampoline out there, and it's typically because of not only the height, but usually there's more than one kid on the trampoline, and those kids are running into each other. One of the most common scenarios we see is a little kid, like a 3 or 4 year old, and big Uncle Bob lands on their leg, and then that's what causes these injuries.
And the trampoline parks, does this go for that too? Is it the same thing? Or are we just talking about, do you see a lot of the injuries happening from the trampoline in my backyard?
It's both.
Both.
It's both.
Okay, so going to the park, going on slides, sometimes, the kids want mom and dad to get on the slide with them. But talk to me about just things that we need to keep in mind if we're getting on a slide.
Slides in general are pretty safe, but if a child isn't old enough to hold themselves up and sit up while they're going down the slide, they probably shouldn't be on a regular size slide. Maybe stick to the toddler slide, because what we'll see is that parents will put that child in their lap, and then when they get up to speed, the child's foot actually gets caught under the parent, and that can cause a fracture. It's the number one cause of something called a toddler fracture, is actually going down a slide with the foot being caught under there. So it's best to kind of keep the kid on the slide by themselves, have somebody at the top, somebody at the bottom to catch, but they really need to be strong enough to hold themselves up.
So you're more likely for the child to get hurt if you're going with them thinking that you're protecting them, but that's not necessarily the case.
That's correct.
Okay. Um, all right. We're also talking about lawn mowing because, a lot of kids want to tag along with mom or dad when they're mowing the lawn. I know my kiddo always had his little mower going along with my husband, but sometimes we really need to be careful about that.
Yeah, our recommendation is typically that children not be outside at all when there is a lawnmower running. I've seen devastating injuries over the years where the parent didn't even know the child was outside, and then the child gets hurt by the lawnmower. Especially dangerous is when parents or older teenagers will put the kid in the lap of their riding lawnmower, and that can absolutely cause devastating injury. So kids really need to be kept indoors while that's running.
That can cause death. I mean, or amputation. I mean, awful injuries.
Yeah, it's devastating for not only the child but their entire family. We know that the rate of divorce of parents who have had children injured by lawnmowers approaches 100%.
Wow. Okay. So the ripple effect, we see how that goes. We are also going to talk about sports injuries because kids are doing a lot of physical activity. What type of sports injuries do you see a lot of and treat during the summer months?
The summer months are actually a little bit quiet on the sports injury front. It's a lot of kids are there's different sports going on in the summer that we don't see other times of the year. The big one is like AAU basketball. So club basketball is very big right now. So we do see some of those basketball injuries. Baseball is going on right now. A lot of the recreational leagues are wrapping up over the next few weeks. And then just kind of football season is starting. So conditioning is getting started here in the next few weeks, and then they'll get into pads and start doing their drills. And so we'll see injuries related to each of those sports kind of in turn.
And since we are in the warmer temperature, physical activity, do you see a lot? You're in orthopedics, but do we have a lot of children who suffer from dehydration and the impacts of that as well? Something to keep in mind.
We don't see that much in our office. Usually, those are going to be treated more in your ERs and acute cares. But I just always, just warn parents like if your kid's been out there for a while and they're looking pretty flushed, bring them in, let them cool off. Check their temperature if they're starting to act a little out of sorts. Make sure they're staying hydrated. But yeah, it is important to keep up with that, especially as we get into football season in the next couple months.
Absolutely. So here's the thing. If your child is hurt, sometimes as parents, we're like, you're fine, just brush it off. You're okay. I think we've all been guilty of doing that a couple times. But how do you know? I mean, sometimes there's the obvious, right? If your child is really injured, or where do you go? What do you do? Having Norton Children's in our backyard is really a blessing for us in the community. But what do you do?
It is, it's really nice because if unfortunately, like your kid, if the arm is obviously crooked, that's going to need those ER manipulations. So usually we recommend that families go straight to Norton Children's Hospital downtown. That's where we do those procedures, actually in the ED. Rarely do they have to go to surgery. But if your kid gets injured and you're just not quite sure, the wrist is a little swollen or elbow's a little swollen, but they're otherwise acting pretty normal. That's a tough one because I've done that to my own kids. My recommendation is if they seem to be in a lot of pain, they can't be consoled. If you put them on the couch, give them a little bit of ibuprofen and they're not feeling better, you should probably go get an x-ray and get that checked out. But if they kind of perk up, after 30 minutes and they're up and running around again, and the next day they don't mention it, they're probably fine.
Well, when my son broke his arm, it was a big learning lesson about casts. I never broke anything as a kid, so it was all new to me. But what are some recommendations on caring for a cast and that injury?
So it kind of depends. We're really lucky in some ways. Casts are still not very much fun for kids, especially right in the early part of summer when school's just let out. But we do have a lot of different materials. The traditional cast was made out of plaster of Paris with cotton. They couldn't get wet. They pretty much fall apart if they got wet. They were hot. They were itchy. They were heavy. Modern equipment we can still use cotton, but we also do have waterproof cast lining material. I go to my local pool and I see kids running around with their casts on.
Hmm.
The outer layers are fiberglass, so they can actually, they're a lot lighter and a lot cooler. They still itch and they still get real dirty, but it's a lot nicer than it used to be.
Absolutely. We did the waterproof cast. It was so worth it. But, there are a number of other things that you typically see as an orthopedic surgeon. We talked about the trampolines, the lawn mowers, the slides. Are there any other things that you want parents to know, Dr. Brey, that, hey, we all want to have a fun summer, but let's just be a little bit safe too?
Ooh, that's a tough one. Always kind of my thing is like, stay within the safety limits of your device. Like when I was growing up, we'd take our bikes and we'd jump ditches and things like that. So it's just kind of, just kind of keep an eye on your kids. They're going to be adventurous, especially as they get older, but just make sure they're not taking too many risks. That is one of the big things I see actually with ATV injuries is that, these are kids who are probably too young on a machine, too heavy, and they can have some pretty devastating injuries as well because they're just being a little bit too risky for their age.
Yeah, I think kids sometimes think nothing's going to happen. Mom and dad are panicking too much, but no one wants to see their kid in pain. It's really the worst thing ever. So I appreciate you sharing this advice for our viewers here today. So hopefully your kids will have the summer and enjoy it and be injury free. Is there anything I didn't ask you, Dr. Brey?
Um, Not that I can think of right now. I guess kind of my big takeaway is kids bounce pretty well. They recover from most of these injuries. Really, by 3 months, most broken arms and broken legs are going to be feeling back to normal, back to enjoying their summer. It is very scary for parents, but for the vast majority of kids, they're going to be absolutely fine long term.
All right, great. Thank you so much for your time today, Dr. Brey. I'm Myra, and sorry for Wave Now's Ask the Doc with Dr. Brey from Norton Children's Orthopedics of Louisville. I hope you have a wonderful day and a safe summer.